We are with CEO of Lifespin, Dr. Aliti Nazri. We are having some questions to him regarding his company, his new initiatives, their expansion plans. So, what problem is Lifespin actually solving?
That's a great question. I love it. And we all know the situation when you have a certain condition, you just don't feel well. You go to the doctor and you don't get a clear answer, right? Basically, you get one test and another, but you don't get a clear picture. And that's actually a big issue because when you have a systemic disease or systemic health condition, maybe inflammation or onset of diabetes or onset of other metabolic diseases, then the symptoms are quite vague because the disease itself is systemic. And then the physicians start only with test one, although because they are constrained by insurance companies, for example, that they get only one test reimbursed, they cannot do everything at once, would be economically not feasible. So what the problem we are solving now with the general health assessment is that you get an actual snapshot of the patient's or the healthy individual's health status, snapshot on 8 different organ systems, organ functions, like pancreas health leading into diabetes, like inflammation, leading into different types of downstream diseases, or kidney malfunction, liver malfunction. So basically, or very important also the lipoprotein profile, because the lipid profiles can tell us so much about health. And if you would like to get with the current standard of care, a comprehensive testing, health assessment like that, it would cost you about $1,000. That's not really feasible for most people. And what we are doing is, we are taking a standard blood draw from a patient. We perform our measurement, which takes about 5 minutes. Then we run our proprietary software on the raw data of the blood sample, and then we get this comprehensive health assessment, which basically looks like that, which gives you in a traffic light system the status of your different organ systems. So basically, just to summarize, the problem we solve is many chronic conditions or complex conditions, they start with very vague symptoms. So the physicians are overwhelmed because they cannot prescribe all the tests at once. It would be too expensive, so health economics speaks against it in the short term. And we solve this problem because of the highly cost efficient and highly scalable general health assessment out of a standard blood draw.
Can you let us know much about your technology? How does it work?
Sure. What we're looking at actually is the sum of the biochemical reactions in our body. As we are all living beings, we have many, many biochemical reactions going on, and we measure the products of these biochemical reactions. And this sum, these products are called the metabolome. Now, you all may be familiar with the term genome, with the sequencing of the human genome about 25 years or even 30 years ago. Now, the challenge with the genome and the genes are that they don't give you information about your current health status. That means you may have a gene, for example, which shows you an elevated risk for a specific condition, but you don't know if you will really have this condition. And when you are sick, you cannot really trace it back into a specific gene. What we do on the metabolome is the opposite. So while the genome is highly static, doesn't change, the metabolome changes all the time. That means when we are healthy, the metabolome has a specific way how it looks like, versus when we are stressed or when we are developing certain chronic conditions or even become really sick, then the metabolome has a different pattern. And we are basically unveiling these patterns with our AI-enhanced algorithms.
How can your company expand into international markets? As well as what are the strategies do you recommend for building a global presence?
So, first of all, our core product is a software. So basically, the instrument for the analysis are third-party instruments which can be purchased from third parties. These are standard products, nothing special. And the question is more how to access our product, which is the software, and which is the sample report, basically. So the most convenient way is if a hospital or lab chain, basically, with a personalized medicine department has an NMR instrument, nuclear magnetic resonance, then they can just perform the blood measurement, the blood scanning. We share our protocols as part of our partnership programs, and then they upload the raw data of the measurement to our cloud. Then within minutes, you basically obtain the reports from the cloud. And this is a software as a service, basically. And we have now discussions with numerous innovative leading hospitals in Asia Pacific. They actually have these type of instruments in-house, which is great for us. And then it's really more about how to implement software as a service models into care workflows. And the other model is this resonates especially with our regional customers and partners in Germany or Europe. Is a sent-in model in which basically we receive the standard blood draws from our hospital provider partners, which basically then leads to measurements in-house. We have capacities in-house to even get same day or next day results because it's a very fast and scalable method.
So when you say that, we want to know about a real-time story about a patient who has benefited from fly-based technology.
Yeah. So out of data protection, I cannot specify ID, right? But what I can tell is there are some cases in which, for example, our lipoprotein profiler, basically our lipid profiler, has shown a person the actual lipid profile status. That's an information which typically would cost you in a standard of care practice several €100 in Germany. In our case, you get it as part of the package, basically. And this actually led to awareness that something has to be done in order to control the lipids. And since then, this person is basically in treatment and basically taking care of this. We have also other examples. For example, uh, especially at the onset of some chronic conditions, we can see early on if they are basically elevated risk for diabetes, for instance. And this is basically out of our R&D work because we are launching our general health assessment this month. That means like real off the street stories I'll be able to share in a couple of months.
We'll be loving to hear to those stories again. And when it comes to a company, your product or your technology, what do you think the challenges you are facing it in expanding your technology
Mhm.
and how you are overcoming that?
So first of all, um, it's important to have and maintain high credibility. So basically, everything we do is rooted in uh, very clean science. We are very transparent what our benchmarking studies, what our clinical studies. Although once we sign NDAs with our prospective partners, we basically show all the reports we have. We show the trials we are taking care of, and so basically building trust by being transparent is extremely important. Uh, and then on top, we have peer-reviewed scientific papers, which are basically accepted by the scientific community. So we have papers from the fields of basic preventive care, from the fields of neurology. So basically, these are papers with very well known and respected organizations like the Charité Hospital in Berlin. But that's the foundation. What you then need to do is to speak to the market. And the market basically are the healthcare providers, which are basically hospitals, clinicians, laboratory chains. And at the beginning, when you present a new method, a new product category to the healthcare sector, um, it basically must go along with really deep information by market development, which also includes education of the market, because many people consider metabolomics as a more academic field, which has been true. But one of the major bottlenecks in metabolomics has been the cost structure. And now, for the first time, we can basically make cutting edge metabolomics on scientific level, basically available, accessible for general health purpose. And that's the novelty. And what I'm experiencing is that basically physicians, clinicians who are active in the field of personalized medicine, precision medicine, or in multiomics, they immediately pick up what we are doing. There we actually experience a great acceptance, but then still introducing a new product needs quite a bit of consistent efforts in market development, because it's so extremely important to build credibility so that people really trust. And that's why we are now focusing initially on, let's say, top-notch organizations, because once they accept and once we can share publicly about these partnerships, then it will build further credibility. And basically, one example I can basically share is our partnership with Acıbadem Hospital. We have announced this last year. Acıbadem is part of IHH, so the world's largest hospital chain in Asia Pacific located. And this is actually one of our highly exciting partners, actually. And we have more in the pipeline, but I will be able to share more once it's ready.
Yeah, thank you for that. And being someone who wants to use the Lifespin testing platform, how can I get access to?
Yeah, it depends on your location, basically. So if you're located in let's say, European Union or Germany, it's very easy. We actually have validated self-collection cartridges for blood collection in homes. That means we can actually send these blood collection devices, which are obtained from third parties, to people's homes to basically receive them as a mailed-in blood sample. We have validated the stability of the blood samples, which is very important. And this will be also part of the launch and making our general health assessment available and accessible to a larger market. So that's the case for Germany or Europe. Because of shipment, it's somewhat straightforward. It doesn't take too much time. When it comes to accessibility, let's say in GCC or East Asia, this basically will depend on the readiness of our partners. So we are in actually very excited and very exciting advanced partner discussions. And once these partners are ready, then they will be also able to offer these to patients and also hopefully healthy individuals who are interested in preventive care.
Exactly. Yeah. So, what's next for Lifespin? I mean, the future of the healthcare.
Implementing in near term, that's also our focus this year, is to actually increase our commercial partnerships, increase the accessibility and availability of our testing platform. That's why we will actually address the Sentinel model in Europe quite strongly, and then also, of course, keep working to enable our partners in Asia Pacific. That's basically our important goal, to basically show uptake with big brand providers. And our, let's say, grand vision, or our North Star, so to say, is to actually complete our software in the next couple of years, that you get a really comprehensive health assessment covering all the common types of health conditions. We have a good foundation for that. We are doing lots of R&D projects in this field, but I don't put these programs in a commercial context yet because it's too early. First of all, it's important to enter the market with a straightforward, simple product, just following also the MBA's rule: faster, better, cheaper, as the first generation product. The second generation products basically will have more complex models, will also address more complex disease-related questions, such as, does the patient respond to treatment, which is a very important topic in oncology, example, or basically when you have staging of diseases, there are many aspects which are not being addressed yet in standard diagnostics as of today. And then we have actually another very exciting area of activity, which is aging. So the issue is basically, when you look at elderly people, some of them may have quite a bit of frailty, but frailty is not always visible, and there's no frailty test in today's standard of care. And now we have started recently a program in Hong Kong, which is basically assessing, it's a 3 years project, which is assessing across 2,000 senior citizens in Hong Kong the determination of frailty, and developing basically patterns, markers to recognize frailty early on. Why is that important? If you have a good understanding of the frailty status of a senior citizen, then you can take preventive measures which have a highly beneficial impact on healthcare costs, because you, let's say, avoid hospitalization, or let's say, at least, let's say, reduce hospitalization, improve treatment, because especially with the aging demographics we are witnessing in the Western world, but also in quite a few Asian countries, managing healthy aging is a very important topic from a healthcare economic standpoint. And this is part of our basically outlook.
So, one final question: what inspired you to pursue a career in healthcare technology?
So it started when I was 15 years old. I was watching as a teenager on German broadcast television a documentary which was about how molecular biology tools and biochemistry can help better understanding of diseases like cancer or HIV. And then I got really somehow it started my spark. And since then, I just want to be active in this field. So that's why I studied biochemistry. And then I graduated with my PhD in biophysics. But then I decided to enter a corporate career because I think companies are closer to solve real problems because only then people are willing to pay something for it. So basically, I then ended my career in quite large, well-known companies like Applied Biosystems, which is now Thermo Fisher. I built a new business at Sony in life science, in healthcare, and then I moved over to HP. I was leading HP's global healthcare strategy in Palo Alto. But then I did a cut. Then I decided to change from the, let's say, glamorous, fancy 1400 world to the, how should I say, rocky, tough startup world. But I have to say, I had never so much uh, fun while being in a startup. So that's why I basically enjoy this type of continuous challenge of implementing new healthcare technologies in the market, which is a tough exercise, but I love it.